we are going to study the mechanism of action of sedatives hypnotics, which means we are going to see how sleeping pills work. But before seeing how these pills are putting us to sleep, we first need to know how our body normally acts or produces what it produces to put us to sleep. So we are going to see the normal sleep physiology. In this part, we are not going to talk about the different stages of sleep. Rather, we'll be looking at it from a chemical point of view, what chemicals are being produced in the brain in order to depress it, in order to put us to sleep. So for that, we'll take a mini version of our brain. This is the cerebellum, the brain stem, the pons medulla, then there's the pituitary gland. Over here will be the corpus callosum. Here will be the pineal gland. Okay. Now the important ones over here are this hypothalamus, important components, the pineal gland, the reticular activating system. These play the major role in sleep physiology. Not the complete hypothalamus, but the nucleus in hypothalamus, that is the suprachiasmatic nucleus, the reticular activating system, and the pineal gland. So, how does it actually work? The suprachiasmatic nucleus is mainly responsible for putting us to sleep. It promotes sleep. Okay, this much is clear. While the reticular activating system, RAS, promotes wakefulness. Obviously, one of them can be working at one time to do what it wants to do. So, RAS will use different mechanisms in order to keep us awake, obviously, a very complex mechanism. One of them will also be to inhibit sleep. RAS needs to inhibit sleep and promote wakefulness. So, how does it inhibit sleep? By producing different chemicals like orexin and histamine, which inhibit sleep. What promotes sleep? Now comes our major players. When they're dark, there are high melatonin levels in our body, and cortisol is lowest. As the night progresses, the melatonin levels decrease and the cortisol level increase. So by the morning, the cortisol levels are the highest and melatonin levels are the lowest. This melatonin is released from the pineal gland when it's dark. Melatonin then acts on the hypothalamus nucleus, on the MT1 or the MT2 receptors, which then promote sleep and inhibit RAS, right? Inhibiting RAS. How does it inhibit RAS is the main thing, because it inhibits RAS by producing GABA. GABA is very important. It acts on the GABA receptor on the RAS, thus inactivating RAS. GABA is an inhibitory neurotransmitter. So when it enters into the receptor cells, it hyperpolarizes the cell, thus making it incapable of receiving action potential to threshold level and activation, which I will describe in a moment. So it inactivates RAS. Thus, it is basically inhibiting wakefulness and promoting sleep. So these are the normal physiological neurotransmitters or chemicals which we need to know which induce sleep. Now we will be studying the mechanism of action of different sedatives. Among them, first we will go towards the drug that acts on the melatonin receptor and promotes sleep and inhibits wakefulness by acting like melatonin. That drug is ramelteon, one of the miscellaneous group drugs, having a lower dependency than benzodiazepines and barbiturates. It acts on the MT1 and MT2 receptors. I'm very sorry, I used the arrow wrong. It acts over here. So it is a melatonin receptor agonist. Then the second drug group, actually two drug groups, benzos and barbiturates. The benzodiazepines and the barbiturates act on the GABA receptor. They either potentiate the effect of GABA, increasing its effect, or they increase the duration of action of GABA by keeping the GABA channels open for a longer duration of time. That is barbiturates, and potentiation by benzodiazepines. We'll study further in detail how these work. But before that, we're going to study some other drugs. After that are suvorexant, and antihistamines. These drugs are basically the antagonists of these orexin and histamine. They are antagonizing their action of inhibition of sleep. Basically, these drugs do not allow them to perform their inhibition of sleep. Thus, sleep is promoted. That's how these drugs work. After that, there was a drug called buspirone. In order to not create any confusion, I'll be talking about it separately. It is a serotonin receptor partial agonist, which is 5-HT1A type in brain. Serotonin receptor. Serotonin basically, when released from a nerve ending, when serotonin is released, it will further cause the release of GABA. Basically, it also acts through GABA. This is majorly how these drugs work. Now, the drugs we are going to do in more detail are benzodiazepines and barbiturates. The benzodiazepines and barbiturates act via the GABA A receptor present on the reticular activating system. It has 5 subunits, including 2 alpha, 2 beta, and 1 gamma subunit. This is how the receptor looks like. Yeah. Alpha, beta, and gamma. If we cut it in a horizontal section, you can see it like this: alpha, beta, and gamma. Between this receptor, there's basically a chloride channel. This is the chloride channel, to which chloride ions will move into the cell. This receptor is basically on the membrane of reticular activating system cells. So, when this channel is activated by GABA, it will cause more chloride ions to go into the cell. When more chloride ions enter the cell will become more and more negative. As the negative potential increases, thus the cell becomes hyperpolarized, which means now it is harder for an action potential to be generated. Cell has been hyperpolarized, so the threshold for action potential increases. Now, how does GABA basically act? Where it binds and where benzodiazepine and barbiturates come into action? This we are going to study now. GABA basically acts on its own receptors. These are the GABA receptors. While the benzodiazepines and barbiturates have a totally different receptor. They do not bind on the GABA receptors. This is the benzodiazepine receptor and this is the barbiturate receptor. Benzodiazepines and barbiturates both increase the action of GABA, but by different mechanisms. Benzodiazepine potentiate GABA by facilitating it to move more through the GABA channels, while barbiturates increase the duration of action of GABA by keeping the channels open for a longer period of time. Well, this one potentiates action. So this is how both of these act. This, besides benzodiazepines, there is also a receptor right by benzodiazepines for the Z's, the zolpidem, zolpidem, and azopiclone. These also have the receptor on GABA, along with which there is a receptor for flumazenil, the antidote for benzodiazepines. That is the sole reason why flumazenil is an antidote for benzodiazepines and disease, but not for barbiturates. So this was all about the benzodiazepines, barbiturates, the mechanism of action of different other miscellaneous group of drugs. This concludes our session.